Hello, everybody. My name is Benjamin Day. I'm the executive director over at Healthcare Now.
And I'm Gillian Mason. I'm the communications director at Healthcare Now.
Oh, you're also at Healthcare Now. What a coincidence! It's funny to run into you here on this streaming at our conference. So we're here today to introduce you to a new campaign that Healthcare Now is going to be rolling out about a month after this conference ends. So we're talking about early May-ish. And it's called the Healthcare Census 2022. It's called that because Gillian is a marketing genius. But what the Healthcare Census 2022 actually is a base building campaign that is built around conducting a healthcare survey in your community or in your organization, wherever you live, to identify new folks and get them involved in the movement for Medicare for all. Gillian?
Awesome. So just to give a little bit of context, right? Some basic math. We all love math, right? So basically, since the beginning of human existence, the power to make or influence change has always been achieved through the sum of the number of people you have available and the resources that you have available. And of course, in our contemporary capitalist society, that means people plus money. So power equals organized people plus organized money. Of course, in our movement, we value people over money. And we believe that even people without money can make change. But if you don't have much of one, you better make up for it with a whole lot of the other.
Yeah, you have to carry the one in that equation. I'm just kind of envisioning the first man and whatever their organized people and resources would look like. But yeah, we all know what we're up against in order to win Medicare for all, right? There's a huge healthcare industry with massive resources. Not all of it is opposed to Medicare for all, but there are big chunks that would lose money or be entirely put out of business if we pass Medicare for all and make healthcare right. This is just a staggering chart about only healthcare industry lobbying spending in Congress over the last, couple of decades. You can see that there's a real spike around the Affordable Care Act in 2010. That's kind of what you'd expect, right? That everyone's lobbying, throwing money at the problem, trying to prevent the Affordable Care Act from happening, trying to make it as industry friendly as possible. And I will say they succeeded in lots of parts of the Affordable Care Act. But I mean, look at the last few years, though. Basically, that peak of spending during the Affordable Care Act is the new normal that the healthcare industry spends every single year now. And, in no small part of that is our enemies, the Partnership for America's Healthcare Future, this very Orwellian sounding organization that is it's a coalition of mostly healthcare industry entities who are organizing to defeat Medicare for all at all levels, at the state level, the national level. And we're not even looking at the money that healthcare industry spends, for example, on advertising, on social media campaigns, on donating to candidates' campaigns. This is just their lobbying. So this is the form of power that the healthcare industry wields, and it's very, very influential. And to beat it, we're going to have to build our own form of power.
Absolutely. So many of you have probably seen this graphic or a similar graphic before. They're the organizing fish. And, basically what I wanted to say is just that what we do have on our side is people, right? There are millions of more folks who are being harmed by for-profit healthcare than the handful of people who are actually benefiting from it. And the industry uses its organized money to spread misinformation, buy candidates, and also to divide our movement, right? And that makes us a lot like the fish in the first picture, just swimming for our lives in every different direction, just, desperately trying to get away. Mm-hmm. But when we start to organize our people, though, take on that big fish shape, we're actually capable of taking on larger predators. And that is why we do base building to win.
And, what is base building? Base building, I guess, very short, is when we do outreach work to get new people involved in the movement. And I like to, you want to compare base building campaigns with pressure campaigns. A pressure campaign, you're kind of mobilizing the people you have already in your movement to put pressure on a decision maker, whether that's, a legislator, whether that's a corporate entity, getting that decision maker to do the right thing. But base building is really focused on building the power of the movement, saying we're not there. We don't have enough power yet to win this. And we have to bring new people into the movement. And way too often, not just in our movement, but I think in most social movements, we get fixated on running pressure campaigns, right? We take the people we have and we throw them again and again and again up against our enemies, up against legislators. We have the same district office meetings with our legislators over and over again. And we're like, hey, why aren't they doing the right thing still? And the answer is we just don't have enough people. We don't have enough influence. We don't have enough power. We don't have enough people with powerful stories to tell who are making a compelling moral case for Medicare for all. So that's why this year in particular, we are going to be focused on healthcare now. Our focus is going to be base building. We really feel like our movement is at a place where we have to step back for a minute, and instead of just throwing ourselves again and again and again at these decision makers with the same groups of people, we need to be growing our base out. We need to be reaching out to new people. And of course, this is, base building is one piece of larger grassroots organizing movement.
Yeah, absolutely. So grassroots organizing, term we use all the time, very rarely actually talk about what it means. And I think everyone has a kind of separate idea in their head of what it means. So just wanted to kind of surface a common definition for us. So the first part of grassroots organizing is grassroots. And that means social change from the bottom up. And that's making sure that impacted people who actually know the problem from experience are the ones who are leading the fight and having a big voice in where the campaign goes and what we're demanding. So, a good illustration of this, I think, is the congressional rep from Massachusetts, Ayanna Pressley, member of the squad. And she puts it this way: the people closest to the pain should be closest to the power. The people who really know.
Thank you very
yes,
much.
Indeed. Ben's rep. Thank you for voting, Ben. And so, we have this idea that, like, if you have experienced the negative parts of the healthcare system, you really know the best things about what's going to change it. So the second piece of this is organizing, right? And mostly organizing is just a lot of deep conversation. There's a great story about when young activists asked Cesar Chavez, how do you organize? And Chavez replied, well, first you talk to one person, then you talk to another person. And that young activist was like, no, but how do you organize? And he was like, well, first you talk to one person, then you talk to another person, and then you talk to another person. It's all really just about conversation. And today in this day and age, we all love social media, right? Because it allows us to talk to so many people at once. And in some ways that gets us off the hook. But you might be able to get some important information or a really great saucy hot take in one of your tweets. But this just is not as effective in building trust, changing minds, persuading people to take action, or giving them the kind of confidence and support that they need to go off into the world and organize others, which is ultimately what we want to happen because we want to amplify the effect that we're having.
Did you just say that tweeting is not organizing, Gillian?
I mean,
shocking, eye-opening revelation.
Do I need to say it? Anyway, so basically, if we actually want to change people's minds, if we actually want to engage people, if we actually want to build a movement, it takes engaged, one-on-one, real conversation where we share our values and, most importantly, listen. And there is just no shortcut to that. Now, I know what you're thinking. We have to talk to people.
This doesn't come naturally to everyone.
Look, here's the deal. When is the last time that you talked to someone about Medicare for all? For a lot of us, it's been a while. So we get it. Talking to people, especially strangers, can actually be awkward and weird. Let's just name it. Maybe you've always been shy, or you're always afraid of saying the wrong things, or you don't get social cues, or all sorts of things. Or maybe you've just been spending a lot of time alone in the house since COVID hit. But whatever the reason, it can be really hard to start a conversation. Sometimes having a reason to talk with someone can make things less awkward. And that is where the healthcare census comes in.
Yeah, and I just want to emphasize again what Gillian said, which is I hope everyone listening takes a moment to just pause and think, when was the last time you talked to someone you didn't know about Medicare for All? And I'm sure there's some of you who are amazing, sort of natural base builders. You go out and talk to folks you don't know, but especially during COVID, our interactions with strangers have been kind of limited, for safety reasons. And I think a lot of those skills have kind of atrophied as well. And I think it's perpetuated this tendency that already exists in our movement and most social movements to kind of talk amongst ourselves, to sort of, preach to the choir, so to speak. So this
Beth,
is, yeah,
we're all outsiders. People who are insiders don't feel any pressure to change the world, right? If you
that's
feel
true.
completely normal and you feel like you're part of the mainstream, you have absolutely no reason to organize. So frankly, we're all a little bit weird.
Yeah. And, this is why we really like the idea of a survey campaign. It's why we chose a survey campaign for base building in particular. Surveys are, at least the way we're going to use surveys. Some people use surveys for collecting data. That's not how we're using surveys here. We're using these surveys as a structured form of listening, which is, it is really the most important organizing skill that we have for building relationships with new people who we don't know yet. And, as Gillian said, our movement should be led by those most affected by the healthcare system. Well, how do you find people who are the most affected by the healthcare system? You have to talk to them and ask them about their experiences with the healthcare system. So surveys let you ID the folks who have been directly and severely impacted by the healthcare system, and to get to know them and build relationships with them. And survey responses are also kind of the start of a healthcare story. As people are answering the questions, they're starting to sort of cobble together the building blocks of what will later become them telling their healthcare story, which is the most effective messaging for Medicare for All to the public in general. And another thing I wanted to mention is that, a survey campaign lets us as a movement be really intentional about who we survey. So, you can avoid kind of unintentionally marginalizing the communities that are most impacted by the healthcare crisis, and be really thoughtful and intentional about who you reach out to and which communities you're building a base in. And I guess the last thing I would mention that's not on the list here, but you can do surveys in person, but depending on how you feel personally about your safety level with talking to a person one-on-one, using safe COVID safe measures with masks and everything, maybe that's still uncomfortable for you. You can also do surveys online in Zoom, and our campaign is actually going to support doing surveys in all different formats. And you could maybe meet somebody in person, get them to very briefly sign up to do a healthcare survey that you can then do online as a phone call or on Zoom. So again, surveys are also nice, I think, because they are a form of base building, meeting new people that can accommodate all different levels of your COVID safety and COVID comfort levels. Let's try saying that 5 times fast. COVID comfort levels. COVID comfort levels. Gillian, can you tell us a little bit about what the census is going to look like, sort of in practice?
Absolutely. So basically, the Healthcare Census is a project that we started here at Healthcare Now, and we're engaging with all sorts of different partners on it. Our goal is ambitious. It is to talk with 10,000 of our friends, family, neighbors, and coworkers all across the country about the healthcare crisis, better understand the issues people are facing, and invite folks who are impacted by the current healthcare system to join us in fighting for Medicare for All. So the Census Tool itself is basically a 15 to 20-minute survey about issues that people might face in getting or paying for medical treatment. And it's designed to start meaningful conversations about the state of our healthcare system. It can be conducted, like Ben said, over the phone, via Zoom, or in person, with COVID safety precautions in place.
Always, yeah.
We know in different parts of the country that's going to vary. So it's really important for this to be a useful tool for folks to be adaptable to what's going on in your region and, how people are feeling in your community. So basically, the way it's going to work is that organizations and individual activists volunteer to collect surveys with folks in their networks. Um, Healthcare Now is going to provide training on how to collect surveys and connect with potential Medicare for All supporters. We're offering tech and logistical assistance in carrying out the campaign. And we're going to be hosting monthly support calls where folks can report back on their progress, brainstorm solutions for the obstacles that we're all facing together, and then build community with other folks who are passionate about healthcare justice.
Yeah, and the bulk of the questions that the census covers, the survey instrument covers, just the whole range of ways in which our lives can be affected by the healthcare crisis. So it's going to cover some key areas like asking people about their insurance coverage, about have they dealt with denials of their care, what kind of healthcare costs do they face? Are they dealing with medical debt? And then are there barriers to accessing care? Are they avoiding getting the care that they need, or they don't feel that they can because of the cost barriers? So these are, I should say we're borrowing this instrument from some amazing healthcare survey campaigns that have already been done in New York and in Maine and in Pennsylvania, who've used instruments like this to reach out to people. And it turns out that, once people get thinking about all the different ways that the healthcare system impacts their lives, sometimes they don't even realize how much their lives have been impacted by the healthcare system until they've talked it through with someone like us. So.
Absolutely. So, basically we spend that time listening and building trust, right? Talking about what people's experiences are. And then we transition a little bit from the personal to the political. And we ask people to share their feelings about the overall healthcare system. You can see one of the questions there is, do you think we should make sure that everyone in the US gets healthcare they need? If you could change anything about the healthcare system, what would it be? Basically, we're getting people to articulate that out loud, right? That, really it's a kind of a shared value. The majority of people, even those people who have really different political ideas from us, share the conviction that everyone actually has should have the opportunity to live a healthy life. And getting people to say that out loud is a good first step to re-examining the politics of the issue from that moral lens. So, finally, we ask people to get involved. We invite people into our work and ask them for permission to follow up, so that we can invite them to meetings or invite them to events or see if they want to come out and collect some surveys themselves. Basically, when you've completed an interview, at the very least, you have a better sense of how the people around you are thinking about healthcare, which is valuable. And at best, you'll have made a connection with the next big leader in our movement who is going to lead us to Medicare for All. So the next step for engaging that person is really important to take. But the first step is this great conversation that you're going to have.
Right, absolutely. And, contrast this survey approach with talking at people about how great Medicare for All is, and then having frequently asked questions where, we practice how to argue with them basically about how all their concerns about Medicare for All are wrong, and we tell them why we're right. That's really different than this listening approach that we're taking. So we've set this goal, this ambitious 10,000 goal, to grow the Medicare for All movement by 10,000 new people. Just so we can track whether our movement is growing or not. Are we growing the movement? Are we adding the new leaders who are going to get us past the finish line and actually win this movement in the next sort of phase of the fight? So that's, the nice and the hardest thing about a social movement like ours is that we have a lot of different organizations. All of them have different orientations. All of them use different strategies. All of them use different tactics. But for any of them to work, we need more people. We need a lot more activists, and we need a lot more leaders in this movement. So that's really what this is about: growing the power and growing the size of the movement so that all of our tactics, all of our strategies have a chance of winning and bringing us to the finish line here.
So we are going to be talking about this throughout the conference, and we're going to be giving you a lot more opportunities to sign up, get involved, plug in, ask questions. But now and throughout the campaign, if you want to get in touch with us and talk to us about the Healthcare Census, you can always email us at healthcarecensus@healthcare-now.org. And we'd love to talk to you about this effort and how we can make it a useful tool for your on-the-ground organizing.
Yeah, and we'd love to have organizations who want to sign on to the campaign, as well as if you're just an individual and you want to sign on and do surveys on your own. So we really look forward to hearing from you. Thanks so much. Bye, everyone.
Thanks.